Hi, we are Team 404 and I'm Michelle.
I'm Jenny.
I'm Rachel.
I'm Nicole.
I'm Kitty.
I'm Lily.
Today, we will talk about how we can address misinformation under COVID-19, and our target country is Vietnam. Since COVID-19 is a new disease, it becomes a big challenge. The public can receive related information through traditional ways and modern ways. As social media becomes the mainstream in today's society, the users are able to receive different sources of information online. However, there is a risk of misinformation. When the public does not know much about COVID-19 and the desired information is much more than the authorized source provided, they may try to believe in misinformation. Here are the common misinformation in Vietnam. The public can easily feel confused when they face misinformation because they do not know whether they are right or wrong. Moreover, physical and psychological health can be threatened. If people drink ethanol and bleach or are exposing themselves to the sunlight, their internal organs, skins, or eyes can be harmed. False information related to the spread of COVID-19 and anti-epidemic measures can raise the stress and anxiety level of the public. Furthermore, social order can also be threatened. When there is a city lockdown message, people may undergo panic buying, as they worry whether they have sufficient food and necessities. Moreover, misinformation about 5G mobile network can mislead the public to destroy the 5G infrastructure. Here are the ways of combating misinformation in Vietnam. In our proposal, we will design a new local app. One of the major characteristics is the centralized platform. We aim to include as much misinformation as possible from all different sources to give a more comprehensive way to people in Vietnam. We also target to combat misinformation and elevate unhealthy behaviors based on misinformation. Another major characteristic of our app is enhancing public health literacy and digital literacy. We aim to educate users how to identify reliable sources of information.
For our technology-based solution, we created an app, Healthagram. Healthagram is an app that's created due to COVID-19. There are 3 categories in this app, which represents 3 main functions. The first function is to update information about COVID-19 regularly. The second function is to provide a platform for verifying information provided or asked by users. The third function is to educate on identification of reliable and credible sources of information. For the first function, a team of healthcare professionals will collect and gather accurate information from reliable sources. For example, data of confirmed cases, COVID-19 information from WHO with translation, how to prevent being infected from COVID-19, misconceptions and myths, and the vaccination program. For the second function, users can ask questions about COVID-19. A team of healthcare professionals will answer the questions directly. If some of the questions have been asked frequently, it will be posted in the misconception and myth session. For the third function, a list will be provided with some of the reliable websites and medias. Also, users will be educated on how to distinguish reliable sources. For example, .org and .edu websites are more reliable than .com websites. Also, users can check the author's background information to decide believe the source or not. Vietnam has different ethnicities. As they reach more people to use this app, 3 languages will be provided, which includes Vietnamese, English, and Chinese.
To better develop this app, we will partner with the Ministry of Health of Vietnam and Vietnam National University. For the Ministry of Health of Vietnam and University of Medicine and Pharmacy, they provide manpower to update and verify information about COVID-19. For the University of Engineering and Technology, they provide technology and manpower to design and develop them. To maintain the sustainability of Healthagram, health topics will be extended to common chronic illnesses such as hypertension and diabetes mellitus. So even if COVID-19 is no longer a threatening issue to us, users can also gain health knowledge through this platform.
Next, we are going to talk about our plans on measuring the impact. To measure the changes, we have 3 approaches. The first method is data usage measurement. The second method is uses of quizzes. The third method is a feedback mechanism. By counting and analyzing the number of people who download the app from App Store or Google Play, we can understand the coverage and extensiveness of our social media platform. It is important to know whether our app can influence people from different age groups. Statistics show that Vietnamese spend 5.1 hours on mobile apps a day and spend around 28% time on social networks, which account the most. By measuring the time spent on social media platforms, we can know that how our app is impacting people's lives and ensure people are receiving information from our social media platforms. Also, we can analyze the view counts and interactions, for example the likes and comments of users in the app to measure whether the news and information posted are reached out to the users. Secondly, we can use quizzes to measure people's understanding. We will launch quizzes before users start using the apps, and questions will be about the knowledge of COVID-19. For example, what are the symptoms of COVID-19, how COVID-19 is transmitted, and what are some precautions we can take. And after some time, they have used the app, for example, 1 month, 3 months, and 6 months, users will be tested again. By comparing results of quizzes before and after using the app, we can see if there is an improvement in understanding COVID-19 and ensure correct information is delivered to the users. To encourage users participating in the quizzes, incentives are given. Users will receive points and can be accumulated to exchange for gifts, for example, vouchers and coupons. Lastly, we will collect users' feedback by survey. We can ask for feedback before expanding the app so that we can understand the users' needs more and improve our application.
We are planning to launch Healthagram in early 2022. Here's our brief timeline for the activities in the coming year. The short-term objective of these activities is to enrich people's knowledge on COVID-19. In the first quarter of 2022, in order to increase its exposure to the public, we are going to put up advertisements on social media platforms, give out free gifts, and invite celebrities to promote Healthagram. In the second quarter of 2022, we will conduct an online user survey to see whether there are any adjustments or improvements we need to make. After enhancing the app, in the third quarter of the year, there will be some pop-up quiz to test the users and see whether they have a clear understanding about COVID-19. Scoring full marks in the quiz will receive vouchers or coupons as a reward. At the end of 2022, we will collect the number of users and views to measure the impact brought by the launching of Healthagram. If the number of users reaches 15% of the population, starting from 2023, we hope to expand the use of Healthagram to other health topics, so as to improve the overall health literacy of people in Vietnam. If it is possible, we hope to make further expansion so that other countries can be also benefited from Healthagram.
We have a budget of USD $50,000, which includes human labor, gifts, and promotion and advertisement fees. We will recruit 5 healthcare professionals to collect accurate information about COVID and answer users' Q&A questions. We will recruit a marketing specialist to facilitate smooth advertisement of the app and serve as the bridge between the app and the general public. We will recruit 2 IT staff to facilitate smooth operation of the app and develop user-friendly interface or functions of the app. For the 5 healthcare professionals, their total salary would be 3,220, and for the marketing specialists, their total salary will be 3,350, while for the IT staffs, their salary will be 5,154. Gifts will be given to encourage users to participate in quizzes, and for the first 1,000 users who download the app and share the app with their friends, they can get vouchers. There will also be promotional costs as we will make advertisements on social media or health websites, and we will also invite local celebrities to advertise the app. Besides, app development cost is used to design the app interface for upgrading and multilingual setup. So the gifts cost $2,400, while the app promotional cost is $8,000. Lastly, the app development cost is $27,000. So the total cost is $49,124. So what are the limitations of the app? The first problem is about the limited coverage, as the app is specific to smartphone users. Another problem is the language barrier, as our multilingual system do not have all the languages. Lastly, it is the information on social media, which is hard for us to fact-check. To solve these limitations, we can encourage users to deliver information to others by pressing the share button. We will also develop other languages version of the app in the future. Lastly, we can recruit volunteers to help us to proofread the information on the social media.